Welcome to Chapter 13, Personality. In this chapter, we're going to take a look at a number of different theories of personality and how our personalities emerge and develop over the lifetime. We're going to start off with taking a look at the psychoanalytic perspective. And essentially, Sigmund Freud and talking about his development of the unconscious mind and his theory. We'll go through that in some pretty good detail in the first three parts of this lecture. Then we're going to move on and talk about the humanistic perspective and talk about two gentlemen who have been very prominent, Abraham Maslow and Carl Rogers, and take a look at their theory focused on the development of the self. We'll also take a look at the trait perspective, which really isn't a theory of personality, but is a perspective more on how we can describe personality. Then we'll finish up with taking a look at social cognitive perspectives on psychology, which are very popular today, and take a look at the notion of exploring self. Okay, so let's get started then. When we talk about personality, essentially what we're talking about is an individual's characteristic pattern of thinking, feeling, and acting. And that's kind of what characterizes us from day to day. Well, we have minor fluctuations and things like that, but kind of what is at the core? And each of us, more or less kind of have a core personality that's a defining characteristic of us. Think about, back to our Disney days and, Snow White and the Seven Dwarfs. And which seems to be a popular topic right now at the movies. But the thing is that we have this is each of the seven dwarfs has a unique personality, and we have one that's bashful, one that's happy, one that's dopey, sneezy, grumpy, dark, and sleepy, and they're all unique. And just as we are all unique, each of us are unique in our own ways, and that's one of the things we'll talk somewhat about as we go through the chapter. But even identical twins have their own uniquenesses, and we've talked about this somewhat in earlier chapters of how that comes about. But there's that inherited genetic propensity to have a certain personality, which probably accounts for about 50% of who we are, and that pattern of thinking, feeling, and acting. And then a lot of it comes just from the environment and the various situations that we're involved in, the way we respond to them, and what the outcomes are. All those things can influence us. Okay, let's begin then and start with part one, psychoanalytic theory. This handsome gentleman up here smoking the cigar, which eventually would do him in, is Dr. Sigmund Freud, who by profession actually was a medical doctor. Okay, we look here. And that, just to give you a little bit of background on Sigmund Freud, he was born in 1856 in Freiburg, Moravia. Lived there until he was probably about 4 or 5 years of age, and then his parents moved to Vienna. His dad, who's noted down below, was a wool merchant, and they kind of went through their own Great Depression. Back at that time, his father more or less lost his business and picked up the family and moved them to Vienna, where Freud would spend the majority of the rest of his life. He's going to spend some stints in Berlin, be a little bit of time in Leipzig, Germany, and at the end of his career, he will be in England, essentially fleeing the Germans. But he grew up in a family with 2 older half-brothers. He had 7 younger siblings, and that. His mom was actually his father's 3rd wife, much younger. She was about 20 years younger than Freud's father. Education-wise, he received his doctorate in medicine at the University of Vienna. I actually went off originally to study law, and then got a position in the medical school and pursued his medical degree. His early studies, after he graduated as a medical doctor, is that he worked with several prominent individuals back then who were studying the phenomena of nervous disorders and trying to treat what we refer to as hysteria back in the day with hypnosis. Now, hysteria today is what we refer to as a conversion reaction, is that you feel the symptoms of something, but you actually don't have them, and kind of akin to hypochondriasis or hypochondriac as we think about. But in a conversion reaction, you literally think that you can't see, you can't walk, things like that. And this is what they were studying and trying to use hypnosis. And he studied under two probably the leading scholars back at that time in Vienna and in Leipzig, Germany, who were prominent in using hypnosis. Following that, he met a gentleman by the name of Joseph Breuer, Dr. Breuer, who had become a very good friend as well as somewhat of a mentor. And Breuer helped set Freud up in private practice in Vienna. And at the time, Breuer was working with a patient that will become known as Anna O, kind of almost as famous as Little Albert. But Anna O suffered from hysteria. And what Breuer found is that when he put Anna under hypnosis and he let her talk about how she was thinking and feeling and things like that, and just let her talk, that when she came out of hypnosis that she felt much better. And Anna actually coined a term that was used back then and called it the talking cure. Sigmund Freud, over the years, being fascinated with the work that Breuer had done with Anna O, started to use a method in therapy moving away from hypnosis and using a method known as a free association, where essentially he encouraged his patients to come in and talk about whatever they want to talk about, to just freely associate, just talk, and without the use of hypnosis. And then he also became very much interested in dreams in later time. But this will become known as the process of psychoanalysis, through which we use free association and dreams in a therapeutic setting. One of the key things to keep in mind is that Sigmund Freud developed his theory is that it was developed back during the Victorian era in Vienna. Vienna was at high society at this time, a lot of great psychological advancements and things like that, and things were rolling along very good. It was also a time, though, where you really didn't talk about sexuality at all, particularly for a woman. Men were allowed to have sexual feelings or drives, but still it was not something that you talked about. And Sigmund Freud is going to become very controversial back in this time, because he's going to develop a theory that it revolves around the theme of psychosexual development. And a lot of people in Vienna were really quite upset with Sigmund Freud when he developed this theory, because it just didn't go along with the pleasantries of the time. And so not only did he have a controversial theory in relationship to the dynamics of it, but it also was controversial in relationship to the social and cultural times. As noted here, Freud will die in 1939 in England, after having fled Austria with the rise of Hitler, as many of the medical doctors and scientists of that time. He'll actually move to the northern part of London. He will set up a practice very much like he had in Vienna, and he will practice psychiatry for a few years before he passes on. Okay. In his clinical practice, one of the things that really got Freud's attention is he worked with a lot of people coming in with nervous disorders. And one of the things is that he did his medical evaluations of the individuals and talked to them, is that he couldn't find any underlying kind of organic causes to their disorders. And this is what started to lead him to think more and more about, some psychological basis for it, rather than it being an illness. And today, a lot of medical doctors will admit that as much as maybe 75% of the cases that they see in their office are related to nervous disorders and high stress and inability to cope. So what Freud was experiencing back then is typical of what psychiatrists, or excuse me, medical doctors still see today. When we look at further, is that one of the things that Sigmund Freud did is he wasn't the first one to develop the notion of the unconscious mind, but he certainly was one of the first ones to really talk about it and also to put it in a somewhat controversial light. But he developed this notion of the unconscious mind. He has these psychosexual stages of development that we're going to elaborate on. And then he develops principles that are known as defense mechanisms. Today, probably out of this, the unconscious mind is something that we still talk about very much, and we've already, discussed it in class, in states of consciousness, and then later on in memory. And the defense mechanisms stay pretty much. One of the things is that over the years, Freud's theory has been very controversial, particularly along the lines of views of sexism and things like that, because we're going to see here, he hits the ladies pretty hard in their development. But through it all, he is probably the most popular psychologist that we have. If you ask most people on the street to say, think of a name of a psychologist, probably it's going to be 9 out of 10 times it's going to be Sigmund Freud. And we use his vocabulary all the time in our everyday lives. We talk about the ego, we talk about the id. You hear people use the term libido and repression and Freudian slips and various terms like that. And so, kind of the lexicon that he developed in his psychotherapy to describe human behavior has become part of our everyday lexicon that we use. As we're going through here, you see that there are a variety of places to click on video links in your PowerPoint slide, and encourage you to do this. Some of them are just background on Sigmund Freud, and some tell you a little bit about the time, and others give you kind of a nice overview of personality theory. But anyways, the unconscious to Sigmund Freud was more or less a reservoir of mostly unacceptable thoughts, wishes, and feelings. And the emphasis here is on unacceptable. It's a lot of pain, a lot of hurt. He felt that when things painful or hurtful happen in life, what we wanted to do is to repress them back deep into our unconscious minds. And kind of like, you got this big long hall in your head. You take these thoughts that cause pain and hurt, and you shove them down that hall, and there's a closet door at the end, and you open up that closet door and you shove them in, you slam that door shut, and you got like latches down, from top to bottom, and you click all the latches to keep it in there. But, Freud also believed that even though we have the ability to repress thoughts, they don't sit there on the shelf and do nothing, but that they are active and that they will push their way back to the surface, back to our awareness, and that's where they become disruptive to us in our everyday lives. And so when he would ask patients to sit and free associate, which was the key thing in a psychoanalysis, what he would listen for are, what are you talking about? What are you not talking about? What can you not talk about? You never mention your mom. You never mention your dad. Must be pain and hurt there. Start to talk on a topic and veer away from it. And you go, aha, that's an indication that causes pain or hurt. And then from there, he would start to probe and to explore. It took a long time to work through his psychotherapy, and he saw many a client over 5, 6, 7, 8 years, and sometimes as frequently as twice a week. And so, I'm feeling these things are very deep-seated in the unconscious. We got to work them out, and even once we have them out, a person can slip back, and that was one of the things. So he would continue to see them. The dream analysis was also a key part, along with free association, in that what he would look for is two things. The dream that you remember every night is what he would refer to as the manifest content of a dream. However, he felt that there was an underlying psychological meaning to those dreams that he referred to as the latent content of a dream. And there's tons of books on the self-help shelves and in bookstores and out on Amazon that, go into dream analysis. And it's probably one of those that's more controversial. Only a small percentage of psychologists today really focus in on looking at dreams, because one is pretty unscientific. We really don't know for sure what are those true latent meanings to that manifest content that one says that they dreamt last night. They're interesting, they're fun to listen to, but they're very difficult to interpret in an exacting way. Okay, so we've talked about is that Sigmund Freud develops this therapeutic approach for treatment approach that is referred to as psychoanalysis. So let's take a break here and come back in part 2, and we'll take a look at Freud's model of the mind.